Hey, Robin here. I'm the Green Smoothie Girl, and I'm back with more great information about integrative cancer treatment. I'm here at Center for New Medicine in Irvine, California, that has within it an Oasis of Hope California branch. We've just been at Oasis of Hope in Tijuana, Mexico, studying with Dr. Contreras, his father's one of the most world famous, and probably the guy who invented integrative oncology, right?
That's right.
Basically the whole term. And Dr. Connealy is a partner with Dr. Contreras in opening an American clinic. And I'm very excited to be here with her. There's not very many women practicing in oncology, let alone integrative oncology. And I just wonder if you could tell my readers, many of whom either are very close to someone with cancer or have cancer, why they might consider being treated in an integrative way, and what is very special about what you do and why you do it.
Well, if someone gets diagnosed with cancer, Robin, they are offered surgery, chemo, radiation, or some combination thereof. First of all, we have to figure out why, where, when, and how did they get the cancer in the first place, and that's something that's never addressed. And the tumor is just a symptom of the disease, but cancer is a disease of the body, not a body part. So we have to treat the whole body, and we're not just going to remove the tumor and expect everything to be okay. So how we're different is we address everything. What is going on mentally, emotionally with the patient? Is the patient in a good state of mind? Do they have depression? If you have depression, you're much more higher risk of cancer. If you have unresolved emotional conflicts, you're much more higher risk of cancer, and that has to be addressed. You have to fix the physical body. What is their vitamin D? Do they have inflammation? Do they have chemicals? Do they have toxins? Are their hormones balanced? Is their blood sugar high? If your blood sugar is high, you're higher risk for cancer. Also, what is their diet like? We have to address what we eat. There are oceans of evidence indicating how diet impacts the body. It's indisputable evidence. We've got to change the way we eat in order to change the way our body works. And people just don't know. And the oncologists are not telling patients. They tell them, oh, it doesn't matter what you eat. It does matter what you eat. We know that was documented by Otto Warburg, who was a Nobel Prize winner, who documented that sugar is the food for cancer. So we have got to eliminate sugar from our diet. Then we address exercise. Now we also have very specialized treatment here. We do hyperbaric oxygen. Cancer cells do not thrive in an oxygen-rich environment. We do IV vitamin C. That's been documented by the National Institute of Health and many countries worldwide that it kills cancer, not to mention many other things that it does. We also use pulsed electromagnetic field. That was okay to do treatment of brain cancer this year. It also treats
by the FDA.
By the FDA, but it's also being treated for pain, for patients who are in pain with cancer, patients who have depression, patients who have neurological diseases, all kinds of different diseases. We also do on-demand. On-demand's a biofeedback device, okay? All your body and cells and organs resonate at a certain vibrational frequency. We can assess the body and see what's out of balance, and then we can correct it with an FDA-approved device called the on-demand. And so utilize...
Suzanne Summers has one in her house. She writes about it. She beat cancer 10 years ago. So
Yes, she loves that machine. And that machine came in 2003. We've had it since 2003. So we use it a lot on all different kinds of patients. But it's all about fine-tuning. And cancer is a multifactorial disease. There's no magic bullet like, oh, here, we can cure it. No, it doesn't work like that. Plus, I have the privilege of knowing people all over the world that have all kinds of different treatments that could possibly help you or me or one of our listeners and viewers that are interested in cancer. There's all kinds of things coming out. Unfortunately, the truth you're not going to hear. It's hidden. Is broccoli advertised on television, Robin?
No, no one makes money.
Exactly.
About it.
Are blueberries advertised? No, but cereal is. So you're not going to hear what's really wonderful and value. And I tell patients, all of my patients, go look it up yourself, verify for yourself. Don't just take my word for it, verify for yourself. But sometimes at some point in time, you have to trust the partner you're working with. That is what trust means.
Right. Well, Dr. Connealy has a fabulous nutritionist on staff, Liliana, who cooks the food.
Oh, yeah.
The food here is lovely.
Yeah, she cooks the food, and then she's a master at nutrition and what she does. So
yours is also the most beautiful facility that I've been to. These are some of the things that differentiate. I really hope that before people just agree on Friday to their doctor sticking a needle in their arm and injecting a bunch of chemicals and metals, that they stop and take a minute and research their options.
And also, but we want to say something, Robin, about that, because sometimes I work very closely with oncologists, because sometimes I may think chemo may be beneficial with all the different modalities that I'm employing. And so we can work as partners, and I can share what we know with their doctor to make sure that the patient's getting the best possible care.
Interesting. So you can not even necessarily be the one administering all the treatment. You can work with an oncologist who's willing to. And Dr. Connealy also does a number of her modalities to pre-treat for chemotherapy. So does Dr. Contreras in Mexico. And that's so that it's less toxic. And
exactly. And it prepares the body, like you said. We have to prepare the body. Do you know in Japan, if you're going to have surgery for anything, they prepare you 2 to 4 weeks in advance so you sail through the surgery.
And generally oncologists here do not do that.
No, not at all.
Yeah. So there's a lot of exciting things happening, not only as alternatives to chemo and radiation, if that's not what you want. There's also things that prep you well and that help you recover after the fact if you do choose those modalities, which makes it integrative rather than one or the other, alternative health. So very privileged to be studying with Dr. Connealy this week. I hope that you check out Center for New Medicine in Irvine, also Oasis of Hope, California, which is in that facility. So thanks so much for being with me.
You're welcome. It's been great to learn from you too, Robin.
Yeah, we got to speak together just a few nights ago, and it was fabulous. I hope we get to do it again. So
we will.
Thank you. See you next time.